Okay. Okay. So what we have to do, they will give you, first you need to show your ID and you will be registered. After that, they will give you short briefing and then they will tell you, yeah, the most important thing, the people try to stress out some specific, like what they have learned in online. It's not necessary. Sometimes they ask you to be a natural. How would you do take the history in real time in your language, but you just have to convert into in English means to translate it. Okay. So this is what is the scenario. First, they will let you line up and then will let you ask you to stand by the door according to your numbers. Okay. Like you can see in the second guy in the second door. So this is the second station. So he will start from there. The bell will be ring. Okay. When the bell will be ring, you will get inside. You will have total 9 minutes. 1 minute outside of the station and the 8 minutes inside in this station. Did you get my point, guys? Can you hear me?
Yes, sir.
Okay,
Yes.
yeah, that's great. So 1 minute when you will read the scenario, then the the bell will be ring and then you will get inside. This is a simple, the same everywhere, like in the college student, if you ever had ASCII exam, so it's the same. So when you will go inside in the station, you will open the door and you will greet. Okay. So this one we will focus in the next slide. Okay. So this is about how you will be in the exam center. Exactly the same. No anything different. This is the door. You will stand outside and you will read the scenario and then you will get inside. Okay. So the minutes I told you, 9 minutes total, 1 minute outside of the door and the 8 minute inside. Once you ring the bell, you will have to get out and go for next station. This guy, for example, here, then he will move to the next station, read the scenario again. And again, the ring bell will be ringing, then you have to get in. Okay, this is just about the exam center. And please note that I'm using the free version. So maybe this meeting will last 35 minutes, but you can get it again. Okay. Okay, the next slide is our MRCEM OSCE London diet. So first of all, you need to apply online via ORCAM website, the same way as you did for the MRCEM Intermediate. And after that, these documents you must make ready while you apply. Your country medical registration, internship certificate, which we can say the house job certificate. Okay. Your country medical registration, like you should have a permanent license or we can say full license from your country. That would be the better because when you will apply, they will reassess your documents. They make sure that you have you're eligible and you have the experience which is required for the MRCEM OSCE. Next, you have to sign up for the visa application. Once you got the confirmation, you have to wait around 3 to 4 weeks. You got the confirmation, you got the slot, then you will go for a visa. They will also give you the visa letter if you belong to any other country which require visa for the UK. First, mostly European Union countries who has a passport from European Union, which are 27, they don't require any visa for that. Okay, so you will be signed up for gov.uk and you will get the credential on your mail. You have to sign up there and then you have to log in and you have to start standard visitor visa. Make sure that the information you're going to put should be true. They will ask you your mother ID, also your father ID. They will also ask you the bank statement because you have to prove the funds. So make sure that what you are going to put, it should be true. If you don't have enough amount of money, then you can use your father's bank statement or the mother or the another one relevant. But you have to notarize from any, it depends on your country. So you must make sure that they notarize it, okay, with what we call public notarize. And then you have to add the document. Okay, so this is what you have to do. Put true information. Don't add extra things. Sometimes the candidates put extra, like, okay, you're earning $10,000 a year, but you are going to put 20,000. Maybe they will ask you the document to prove that you have 20,000. So make sure that don't put extra information. It will cause delay in your visa. So normal standard visa take you around 15 working days. I'm talking about the working days. If you add the weekend, that could be around, I think, more than 25 days. Okay. And if you mention the self-employed, then you need to add the document what business you are doing. Okay. So you should be very careful when you mention the self-employed. While filling online form, you will be asked what is the main reason to visit the UK. They will ask you. In that situation, you will have to need to select business. Okay. There are different kind. This is what I am telling here. This is what mostly usually candidate pick the business, and from inside in the business, they will pick up the PLAB or the ASCII exam. So some people say apply different ways, but this is very common way where you can also give the later. So once you fill the online form, they will ask you these three documents. One, MRCEM OSCE later, second, fund statement, third, your passport. So these all documents you should make ready. So once you attach the following documents, you'll be redirected to the payment method. And there are two kinds of services. One is standard, which is normal, which will cost you, I don't remember exactly, it's been a long time, but they will charge you single amount. But if you want to choose a priority, which you can get the visa within 5 days, so that will cost you 2 times more than the actual fee. Okay, and you will get visa within 5 days, 5 working days. Okay. Anyway, the successful most of candidate which applies tender, they got 15 working days or 3 to 4 weeks, which they also mention on the website. And then once you submit, you will also get the appointment with the VFS, Global Visa Center, depends on your country where you are located. And then you will go for biometric, and the same time you will submit your passport. And after 15 days, you will get your visa. Is it clear so far? Can you please hear me, guys?
Yes.
Okay, that's great. So this
Yeah, yeah.
is I
Clear.
just I just put the screenshot here. You can see that there you will have the online form. They will ask you what is the main reason to visit to the UK. So here you should do this business. Not don't pick up the short-term study because you are not going for a study. You are going for exam, right? So this is on the middle of the form. They will ask you what is the main reason do you choose business, and then here they will ask you like that for the PLAB test, later general medical council. They mentioned though nursing or midwife council is no matter, but you have to pick up this one, okay? The second option, and then you go for further. Is it clear so far? Okay, that's good. Okay, one more important thing I want to add to once you got the visa, you have to fly to London. You have London Heathrow Airport, Gatwick, and City Airport. It depends where you are, but every airport have a special transportation, what we call the bus to Victoria Street. It's not really difficult to understand, so you will know about that. The most important, the candidate facing problem with accommodation. Yes, you need to be very smart when you're pick up the accommodation, especially for the London, and you can save a lot of money. How you will do, there are many hostels which give you maybe charge you from 14 to 20 pounds per night. Okay, so you need to do book these hostels before you land to London. This is one hostel called London Waterloo Hostel. It's around 1 mile away from the Arkham. It's very close, around 10 minutes to walk. So when you arrive, you can stay in this hostel. Every hostel have a lounge where you can practice. When I came to London, I stay in a hostel and I did practice. Actually, it was alone. I don't have anybody, but I asked some people, those were in the hostel, all are the foreigners, means different countries, those are visiting London. So I asked them to act like a patient, and I'm a doctor and can practice. You don't need to care who is she or he is he, but if you want to practice, you can do. It's no matter. So every hostel have the lounge, and every place, most of place in London have very nice park where you can go and practice. Depends which guy is with you. Okay, so it depends. If you have the friend in there, you can practice. The most important in OSCE, practice and practice. Okay. So London Waterloo Hostel is just a 1 mile from Markham, and another hostel called Cephas the Elephant. They charge you maybe 14 to 20 pound per night, and if you stay longer, you can save more money. So another hostel Cephas stays. But bear in your mind, this hostel will not give you a single room, but you will have bunk beds, maybe 10 people with you, maybe 6 people with you, but they have bunk beds, especially they also have the curtain inside. You can cover your place, everything. So this is where you can save some money if you are living in London. Even you can stay. The maximum stay in the hostel is 14 days. Okay. This is about the accommodation, which is normal. And the safest stay hostel is 1.3 mile. It's very close to city center. Here you can walk to London Bridge also. It's London Bridge, Tower Bridge is very also close. After finish your exam, you can go. There are bars, clubs, or everything very, very close. And the most important city center is also very close to this hostel. Okay. Okay, this is about the expenses. And okay, this about roommates. Yeah, the roommates you can have the males or you can have the female too. So in some rooms, maybe you will have female as well. So it's no matter no any gender. I mean, it depends. Sometimes if they don't have the room, they can also put in all male, female together too. So, but if you're a female, you can choose just only female. Okay, female dorm, and then you can just stay with the females. Okay. Next is booking. How you would book. You can use booking.com or you can use Agoda. This is will help you to book your. And there is another website. Some hostel have their own website. If you choose their own website, you will have more cheaper rooms as compared to booking.com or another. If you want to stay longer in the London, then you have to use Spare Room UK website or the app. Here, what's happening in London, most of people are living on the rent. So what the people do, they can, if someone have a house, they can rent out to someone one room. Okay. So Spare Room, you can check out. The normally pay per month is £400. Can start from £350 to £400. Okay. So you can pay in a month. Okay. And some people ask you deposit, but you don't have to worry about that. So you need to make account on this app, and you can search where you are going. For example, near to Royal College, so you can search it, and you will find a room. But you need to pay when you arrive to pay. Okay, do not pay on the website. Okay, so this is about the accommodation in London. Now let's focus on a little bit on the Malaysia diet. Okay, so Malaysia is the same. You will apply online, and you will need documents this one, and you will get the visa. Is very easy to get in Malaysia died within 3 to 4 days. Okay, the cost visa is $20, and it's usually take 3 days maximum, and it will ask you your bank account maintenance certificate or bank statement and your passport. And also, I don't remember exactly, but some people say also they ask like accommodation or maybe the flight ticket return as well. The London also some airport will ask you return ticket, but if you explain them well, maybe you'll get lucky. You don't need a return ticket. You just go for one ticket. I just bought one ticket, so it depends on you. It depends on your country rules, but I'm sure they will stress you out to book the return ticket as well, but it depends. Okay. Okay, so next is our visa application. Yeah, 3 days and 20 USD online, the same way like London died. And then you have the following closer to exam center, these hotel. Oyo Casavala is very, very close, 2 minutes walk. Mercury also 2 minutes walk. Sky Hotel 5 to 10 minutes walk. It is opposite to Salayan Hospital. So what you have to do once you arrive in there, but you can book this hotel on the booking.com in advance or in the Agoda. So once you arrive in this hotel, then you have to go for it. Stay there, and your exam center very close, and there are many people or from India or Pakistan or in any South Asian country you can find, and also many Indian native people. You can have a nice food there, so many things will be very close to you. The arrival, how to reach hotel. So once you arrive in Kuala Lumpur, if you're alone, you need to take the train called Cali Express to KL Central. I will put these all slides in the group, okay? So you can uh, download it whenever you travel. So you should remember it will cost you before 55 local currency. I don't know how much now. And then you have to change to metro train. Okay, this is just go to Cal Central, and from there you need to change to the metro train and or subway. It will then you have to go for Batu Caves. Okay, if the train goes to Batu Cave, is that's good. If not, then you have to go from metro to Cal Central to where's the Masjid Jamek is the stop name. So you need to go there. And from there, you need to go out, take a bus, which is free bus. They will not charge you any money to Bandaria. This bus only goes to this stop. Means this is the final stop. And it's just 5 minutes. Okay. Once you arrive there, you will go to take a train to Badu Caves. Before arriving Badu Cave, there is one stop you need to get off your train, and then you need to take taxi. I don't think so. The bus can go there, but you need to take taxi, which will cost you around 10 to 20 local currency. And then you will arrive to your hotel. Okay. And these hotels are very close to your exam center. So this is about the how you can reach your place. Okay. Now let's focus on the exams. What's actually the RCAM going to test you in this exam? They especially give to everyone this one domain. Before maybe your exam start one day, they will send you the email and they will also mention these domains, the things what exactly they are going to test you. So the clinical examination skills, it gives you 40 score, the maximum. So clinical examination skills, it is not in every station. For example, knee examination, you have to go for knee examination. If you do well, you will get 40. Okay. Clinical reasoning and decision making skill, that means the management plan. So this is in every station. Every station has a management plan. If you go for the examination, you also need to go for the go for the management plan. For example, how you will go for it. There's some guys are asking about the India diet. Yeah, the India diet. I'm sorry, I don't have experience about the Indian, and I didn't collect any more data about that. Yeah, but people said it's very good, and it's similar to Malaysia, and so everything will be the same. But I never been there, and so I know I don't have any idea about that exactly how to go there. So that's why I didn't. In Malaysia, I traveled several times as a tourist, not only for the exam. So I'm very familiar. In London, I'm located, so I know these everything. But that's why I'm just focusing on these. But the exam, about the examination, it's the same everywhere. Okay, so clinical reasoning and decision making is a management plan. So in examination, for example, you found the patient is there is a common peroneal nerve injury while doing examination. Of course, you will give the management plan to this guy. You will say, I will do the x-ray, okay, of the your knee, and I will check it out if there is any fracture of your bone and the head of fibula. So this is the common cause. So then I will involve the orthopedic. Okay, this is called what we say the management plan for that. So whatever you do examination, you will have the management plan. You have to tell the patient what you are going to do in the next step. For example, you did the examination of eye, and you find there is optic neuritis. So what you will say, I will keep in observation. I will do the examination further to your back of your eyes, and also I will involve the neurosurgeon or of the eye physician. So this is what you have to say. So every station has the management plan. History taking, yes. If a patient came with the peptic ulcer disease, you will also say, yeah, I will keep you in the observation room. I will do some tests, which include full blood count and the camera scan, what we call the endoscopy in medical term. So this you also need to say. The communication skills, yeah, including conflict, communication skills, all are the same, like how you will communicate with the patient. Even history taking, if you don't know how to take history taking, that means your communication skills are not very well. Communication means how you will talk to the patient. Okay, including conflict. So when we will do these station, I will tell you how we do. So this include 140 because every station need a communication skills. Every station need clinical reasoning. That's why the score is high here. History taking, your information gathering, you will get 60 score, the maximum. Organization, prioritization skills. For example, patient came with the abdominal pain, but instead you take the history from abdominal pain, you jump up to neurological symptom. For example, you say, do you have any jerky moments? So this is not mean organization. You need to ask step to step. For example, he said, the patient say, I have abdominal pain. Okay, could you please tell me, do you have any association of your abdominal pain with the vomiting? Or is your pain is associated with the vomiting? So this is about the GI system. So this is called means you are organizing, prioritizing what system need to start first. Okay, not jump up to central nervous system before going for the GI here. Okay. And other is practical skills. Yeah, they will ask you, maybe they will ask you to do the suturing. Maybe they will ask you to do, for example, manage the airway. Okay, what is happening in the previous diet? Some candidates from my trust, they said they have a station for the skills. It was like that. They asked him to manage the airway. So patient came with the seizing, but he wasn't seizing. So he said they asked him to manage airway, and they also asked him to prepare the equipment. So what is happening usually if you join, I'm sure you have joined some courses, what people say, you are like a team leader, you don't need to do. No, you're wrong. Any station you go first, you need to show them what you are going to do. You will do first, the nurse will follow you. For example, he said, they asked me to prepare the equipment. So he said, I prepare oropharyngeal airway, I prepare the supraglottic airway, I prepare for the ETT tube and the laryngoscope. And he said, then I show her how to measure the size of the oropharyngeal airway. Okay. And then I show her, and she asked me, can you please do it? I don't know how to do. And he said, I did it. So this is called practical skill. They want to check you out in this case. Well, they also ask you the suturing. So this all, what I want to say, you need to be very familiar with that. The teaching skills, maybe you will have to teach the patient ABG, how to interpret ABG, how to read the ABG, and also the ECG. And maybe they can give you a station like digital nerve block teaching. Please teach the candidates. There is FY2 students, junior doctor. Please teach him how to do a digital nerve block. So you will have teaching skills. So it's custody of 30. Overall, everything needs clinical reasoning and communication skills, all are included in these stations. So this is about the score, how they will test you. Okay, next station, next slide, we have MRCEM OSCE syllabus. You will have history taking station, which will include Oedipus, Socrates. Any patient present with the pain, you have to follow Socrates approach. The Adipara, you have to follow if the patient present to you with without pain or means painless. And there is another approach we will discuss in the next coming slides. Okay, when we will next session, so we will go by step. A resuscitation station, yeah, psychiatry and toxicology station, practical and teaching skill stations. So you can have maybe 2 station history, maybe 3 to 2 station from resus, maybe 2 station from psychiatry, like this. So total, you will have the 18 station, and you will have the rest station. So 16 you have to perform. While explaining and planning, you need to avoid jargon. This is very important. Means you need to avoid the medical term. For example, you are going to tell about the endoscopy. You need to say, "I'm going to
Sorry,
do
doctor. Dr. Andy.
sorry. Yeah.
Some people, doctors are waiting to join. Can you allow him, please?
Very sorry. Let me see. Okay. Oh, yeah, I see. I see.
Thank you.
Yeah, I'm going to pull an in, but yeah. I'm sorry because, okay, okay. Okay. So let's continue. Yeah, so avoid jargon means you need to avoid the medical terms. For example, you're going to talk about the endoscopy. You should say we will do a camera scan. Okay, camera scan. You don't need to say we will perform endoscopy, but you will say we will do a camera scan. We pass the camera from your tube, okay, towards your stomach, and then we will check out. This is how you will say. Or if you are going for ultrasound abdomen, you say we will do your tummy scan, but you don't have to say ultrasound abdomen. Okay, so these you need to be very careful. Do not use the medical terms. Give information in chunks, in pieces form. You need to give information slowly in pieces that she can understand. And then you also check the understanding of the patient. This is very important too. Is it clear so far? Do you have any question? Did you understand what I said just now? So these all things you need to confirm from the patient. Okay. So this is about how. So let's move to the history taking now. So we are history taking. This is everywhere you will find almost the same approach. Okay. Almost the same approach you will find everywhere. So history taking station general approach you will introduce once you get in the station after 1 minute and the bell is ring, you get in, you will introduce yourself to everyone first. First, you will just greet to everyone like, hello, good morning. And then you will sit down on the chair. You will go to the patient. And again, you will greet to the patient like, hello, good morning. I am Dr. BND, or I am, or my name is blah, blah. I am the ED registrar. May I confirm your name and age, please? Or you can say, may I confirm your name and date of birth, please? So it depends. So she will say, for example, I'm Lena. Then you will say, nice to meet you, Lena. Then you will go for gathering information. You will start the question, how can I help you? Or you can also say, please make sure that you don't need to follow exactly what is written here. You can use your own way. Okay. What have you brought you to the hospital today? You can say, okay. Or you can say, how can I help you? What's the matter with you? You can use many different ways to start. Okay. And if, for example, she said, I had tummy pain or I had a stomach ache, then you say empathy. You have to show, I'm really sorry to hear that. Okay. And then if you found, for example, the patient came to you chest pain, then what you have to do is she said quickly that I have a chest pain, then what you have to do quickly move this patient to resus room. Okay. Quickly. Okay, I'm sorry to hear that. I need to move you to resus room, or I really need to move you to resus room to connect to the monitor to check your vitals that you're fine. Is that okay for you? Okay, so then you have to move her to, if the patient has chest pain. I am talking about life-threatening condition, chest pain, short of breath, collapse, bleeding, fears, or confusion. I'm not talking about like stomach ache. So these are not life-threatening. If she said, I have a stomach ache, you just need to go for, are you comfortable now? First, you say, I'm really, really sorry to hear that. Then you have to say, are you comfortable now? Okay. Sometimes the examiner mentioned you in scenario that we gave her the painkiller. If she already got the painkiller, you don't need to give her painkiller. You don't need to say, are you in a pain? Or you need to ask, are you comfortable now? She say, yes. Okay. If she say no, so are you in a pain? She say, yeah, I'm in a pain. Okay. Do you want me to give you a painkiller? Is that okay for you? Okay. That's okay. Then you have to go for the consent. I'm talking here about non-life threatening. Threatening, you need to move her to resus room first. Then you ask her, are you comfortable now? Then you go for further stay. But if non-life threatening, then you just need to go, are you comfortable now? Do you want me to give you a painkiller, etc.? Consent, yeah, you need to take a consent. You can say, I need to collect data, or I have been asked to collect data. Different ways you need to say. You don't need to follow exactly. Regarding your headache or regarding your sore throat. Is that okay for you? If she say yes, then you go. Okay, guys, we are seeing that the almost is going to be 40 minutes, so it's free version. It's my I'm going to use today, but for next meeting I will use the paid version and can go long as long as we can. So what happened here? After 1 minute, this window will close. Then you can join the same way. Join the link. Okay. Did you get my point, everyone? Yeah, this window will be closed after
Yes.
1 minute, then you can join again, okay? The same way.
Okay.
Okay, now is the next step would be like after you get consent, then you have offer nurse as a chaperone. So what you have to do, you need to ask, you need to be very careful. You're taking history for what? For example, if you're taking history, sexual history, or any bleeding vaginal, or any other, then you have to tell her that would you then you need to ask her if she come with stomach pain. Then you don't need to ask her the nurse as a chaperone. I already mentioned here, such as sexual history, vaginal bleeding, urethral discharge, or anything she's coming up. Then you need to ask her, would you mind a nurse as a chaperone attend with us? So this is what you can aid this point. If not, then you just go ahead. Next question. Okay, can you please tell me more about your sore throat? She will say, oh, it's started 2 days ago, blah, 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 blah. Then you say, oh, again, you will say, I'm very sorry to hear that. Let me